Tell you about my personal experience as a female resident on the way to become an orthopedic surgeon. Here we are. And it's nice to see that there are so many interested to take part of this important discussion. When I started medicine, I had big plans. So I organized my first internship within heart surgery. And of course, I was going to be a heart surgeon. Next internship was leading me to pediatric surgery. So I changed plans. And of course, I was becoming a pediatric surgeon. Next internship, I thought I would try internal medicine. But no way. I could see myself going rounds all day. Then I got the idea of trying orthopedics and never left this specialty again. Orthopedics was the one and only, and never since I got doubts about that. Why? Well, I see often healthy patients with an acute problem that I can solve, and within a short time the patient is fine. It's a perfect combination with short ward rounds, outpatients, and operations. And it's a wonderful feeling to work with hammer, saw, and screws to make the bones look like before. Reactions from the outside were not always as enthusiastic. One typical question would be, don't you have to be strong as an orthopedic surgeon? And I was usually smiling politely and saying, no, you don't have to be. But actually I was thinking, what do you want me to answer? Actually, I considered myself as strong. Or do I have to be 2 meters tall and have a glove size of 9? And another typical question would be, are the night shifts very hard? Can you combine family and work? Well, so apparently you just can live a happy life by becoming a dermatologist. But of course, there are real problems. I learned that. The thing with the combination night shifts and family is not as easy as I thought in the beginning. But this is not only depending on choosing a surgical specialty, but also depending on hospital size, catchment area, and many other factors. Another problem is the amount of different operations we have to learn. And we might need to accept that it may take longer time to get competent than before, when it was normal to work 60 to 80 hours a week. But these are today's luxury problems. I consider them like that, and I gladly accept them in favor of more flexible working conditions, the general acceptance that even male surgeons might have to stay at home to take care of their sick children, and by having a social life actually outside the hospital as well. There's also female problems, because even if emancipation has grown far, do many female doctors still think that they must be extra competent, extra fast, extra nice, extra effective at work, and fix kids at home at the same time? I personally have never made this experience, so I would like to ask you, is it really still like that? Or do many female doctors think it is, and therefore feel this pressure? So what makes residency in orthopedics attractive? Well, it's just so cool. But we have to spread this by emphasizing that orthopedic surgeons are excellent craftsmen in combination with high medical knowledge, by denying that orthopedic surgeons only care about the fracture and not the patient, and by telling about what a nice feeling it is to see grateful patients whom I have fixed. As we heard from Cecilia, there are quite some residents, especially female, who actually do leave this wonderful specialty, and what might them do so? There are unfortunately still hospitals with old tradition, and that means we have there an expected weekly working time of at least 60 hours. Female surgeons are not adequate and therefore not welcome. Surgeons don't need lunch or rest, and children are raised by your spouse. So my conclusion is, it is not the profession that makes people rethink, but the circumstances and the environment. How can we now make orthopedics attractive for residents? We have to emphasize how wonderful this specialty is. We have to welcome residents by making clear that neither gender nor family planning should be a reason not to become an orthopedic surgeon. And we have to deny all these prejudices, such as having to be strong and duties are very tough, and the gender disadvantage. How can we then keep our residents? We must judge by competence and loyalty. We have to make new residents feel welcome. We have to assure coaching by coupling senior and resident during operations and outpatient sessions. And we have to tell what is done well and not only what may have been done better. So my take-home message to you is, be aware and take care of your residents, because they might leave you again. Thank you.